Okay, so this is how to do a central venous access device dressing changes. So first, I would always before any of the skills, I would perform hand hygiene. I would uh, draw privacy for the patient, introduce myself, verify 2 points of IDs, and then check for any allergies, do an environment safety check, gather materials, ensure proper body mechanics, and then provide patient education of what we're doing today. So the equipment that we have is set up here. And then the procedure, how we would go ahead and do that would be I would put on clean gloves, and then so these sterile gloves here, which I'll just use these so I can reuse those for the next skill. And then so I'd put on clean gloves and then a mask for my patient, and then as well as any of the family members that happen to be in the room. So I'd put that on them. Okay. And then I would inspect and then palpate. We'll see, it's like here. So I will inspect and then palpate the site around the dressing for swelling or tenderness. Okay. And then I would remove the dressing by kind of holding in the middle here on the catheter site, and then just pulling towards the catheter. So I'd bring it around, remove that. And then I would take remove the antimicrobial or the bio patch too. And then I would use a measuring tape to kind of measure the external portion of the catheter. Is that video still? Okay. It's still recording. I would measure the external portion of the catheter to the previous length, and then that way I can detect any migration. I will then discard my gloves and the dressings, and then perform hand hygiene, and then open the sterile gloves and put those on. So first I would do the alcohol wipe around the area, which is there. So I would open this up, and then that's in there, and then clean around the area. And then I would use a, do we have it here? I think it's this one, okay. No? Crap, I think I put it away. Okay. Well, I can't seem to find it. Okay, so then I would use the CHG swab, and I would take that and kind of go along the skin in a back and forth motion, just gently holding on to the central line to make sure I don't tug it. So I'd do that, and then I'd also take the CHG swab and run it up and down the central line, or just up towards me on the central line, and then just let everything air dry. And then I would take the skin prep and take that out, kind of put it right around the area here. And then I would apply a new bio patch. Is it still recording? Around the, okay, I seriously put that away then. Okay. So I put a new bio patch on, and then when I put that on, I would take a new transparent film dressing. So open that up, and then I'd put that over everything there. I'd remove the paper kind of seal around the outside, save some of that to use it as a label with the date, time, and initial. I would take the tape and then tape that by grabbing the line. I'd want to coil it up so it's out of the way, and then just tape it onto the skin there. And then I would put a label on, like I said, with the date, time, and initials. I would dispose of all the trash that I had kind of in the out of sight sort of area, and then dispose of my gloves, perform hand hygiene, and then I would just make sure that the railing is brought up and the bed's an appropriate height for the patient. And that would be how to do a dressing change.